Tedros Ghebreyesus, who's briefing the media at this time. Let's go there now live.
Offering the broadcast the concert. And Lady Gaga had already raised $35 million as already informed during our conference with her. Third, we're working hard to ensure supplies of essential medical equipment for frontline health workers. So far, we have shipped more than 2 million items of personal protective equipment to 133 countries, and we're preparing to ship another 2 million items in the coming weeks. We have sent more than 1 million diagnostic tests to 126 countries in all regions, and we are sourcing more. But we know much more is needed. This is not enough. So we're working with the International Chamber of Commerce, the World Economic Forum, and others in the private sector to ramp up the production and distribution of essential medical supplies. Today, we're launching the UN COVID-19 Supply Chain Task Force to dramatically scale up the supply of these life-saving tools and match supply with needs. And I would like to use this opportunity to thank the Secretary General, Antonio Guterres, for bringing all the UN agencies to contribute to the Supply Chain Task Force. Fourth, we're working to train and mobilize health workers. More than 1.2 million people have enrolled in 6 courses in 43 languages on our openwho.org platform. Our target is to train tens of millions, and we have all the readiness to train tens of millions, hundreds of millions. Experts have been deployed around the world through WHO's Global Outbreak Alert and Response Network and our Emergency Medical Teams platform. And fifth, we have accelerated research and development. In early February, we brought more than 400 of the world's leading researchers together to identify and accelerate research priorities. We launched the Solidarity Trial with more than 90 countries globally working together to find effective therapeutics as soon as possible. To better understand the transmission, epidemiology, and clinical features of the virus, we have developed research protocols that are being used in more than 40 countries in a coordinated way. We're working with FIND to accelerate development and access to diagnostics. Today, 130 scientists, funders, and manufacturers from around the world have signed a statement committing to work with WHO to speed the development of a vaccine against COVID-19. Of course, WHO is not alone. UN is not alone. Every day, we work with thousands of partners in the government, academia, the private sector, civil society, and more. There are many, many other things WHO has done in the past 100 days that I haven't mentioned. These 5 pillars will continue to be the foundation of our work. In the coming days, WHO will be releasing an updated strategy and a revised strategic preparedness and response plan with an estimate of the financial needs for the next phase of the response. Throughout, our focus has been on working with countries and with partners to bring the world together to confront this common threat together. We're especially concerned with protecting the world's poorest and most to confront this common threat together. We're especially concerned with protecting the world's poorest and most vulnerable, not just in the poorest countries, but in all countries. For the past 100 days, Our unwavering commitment has been to serve all people of the world with equity, objectivity, and neutrality. And that will continue to be our sole focus in the days, weeks, and months ahead. Finally, this is a special time of year for Christians, Jews, and Muslims around the world. Today, WHO has published practical considerations and recommendations for faith-based communities. We know that COVID-19 means billions of believers are not able to celebrate in the way we usually would. But we wish everyone a safe and joyful Easter, Passover, and Ramadan. Thank you.
Thank you very much, Dr. Tedros. I understand we had some technical issues with sound on some of our social media platform. So what we will try to do right now is to send as soon as possible the text of opening remarks to everyone, so you can have it while this press conference is still ongoing. It seems that journalists who are watching us on Zoom didn't have those issues, so they were able to listen to us. In any case, we will have at the end of the briefing full audio file as well, but again, as I said, we will try to send immediately right now opening remarks to our global media list. We will now start with questions, and first we will go to John Cohen from Science.
Can you hear me?
Yes, John, please go ahead.
Thank you. This is for Director General Tedros. I'd like to get your response to President Trump's threat yesterday to cut funding to WHO, and specifically to the 3 complaints he had, which were that WHO criticized the travel ban to China, and that WHO could have called this earlier and probably did know, he said, and also that WHO was very China-centric. Could you respond to each of those?
Thank you. Thank you so much. As you know, WHO has been doing all it can since the beginning. And as I said it in my statement, tomorrow will be 100 days since we were notified of the outbreak. And it's very tragic that we lost many, many lives. But from the situation we have now, not only that we said we have been doing everything we can, but we will continue to do everything, day and night, like what we have been doing, to save lives. We don't want to waste time. Of course, when you're confronting with a new virus like this one, a very dangerous virus, let alone a dangerous and serious public enemy number one like this, we do regular assessments. So we will do our assessment, identifying the strengths and the weaknesses. And this is a tradition in WHO, and we will do that. This is what we call the after-action review. And WHO wants this more than any organization, because we want to learn from our mistakes, from our strengths, and move forward. But for now, the focus should be on fighting this virus. As I said earlier, this is a new virus. There are many unknowns still. When it started, many people didn't know how it would behave. Still, there are many unknowns, and we don't know how it will behave in the future. It's very contagious like flu, but at the same time, more fatal than flu. And if you remember, that's why on February 11, we called it public enemy number one. This is 12, 13 days after we declared the global emergency. I will suggest two things to the world. Number one, at national level, we should be able to work across party lines, across phases, across other differences that we have, across ideology. When there is a crack at the national level between political parties, between religious groups, or between other groups, that's when the virus gets a crack that it can exploit and defeat us. So number one is the national unity, working across party lines. I was a politician. I know how difficult this could be. I know it. Although it's difficult, it's the right thing to do. At the end of the day, the people belongs to all political parties. The focus of all political parties should be to save their people. Please don't politicize this virus. It exploits the differences you have at the national level. If you want to be